Hello, everyone. My name is Wayne Tucker. Welcome to the Infection Control Exchange podcast. Since this is a new podcast, I figured I would spend a few minutes to provide a summary of my background, experience, and education. So, I have about 24 years of healthcare leadership experience, and that was obtained working for a number of different organizations. I've worked in acute care, primary care, public health, as well as long-term care. In terms of my career, I kind of started off in research and then made the change to start working for public health about 24 years ago. So I worked in three different positions in public health, worked as an epidemiologist, which I think a lot of listeners became more aware of that role during the COVID-19 pandemic. And then I worked in a couple of different positions um, for public health as a manager and a director for public health, where I was responsible for infection control, infectious diseases, vaccine preventable diseases, travel clinic, harm reduction program, um, as well as like a tobacco control and enforcement as well. And then I was also a director for infection control with another organization for a couple of years. And then I was in a position with primary care and a dental clinic manager for a couple of years. Also have 5 years experience working for three different long-term care organizations. Um, and then in terms of my education, I have undergraduate and a graduate degree in psychology, and I have an executive master's of business administration, and I'm currently working on my master's of infection control, which I'll complete in the next few weeks. In terms of my certifications in infection control, I have two international certifications in infection control. One is the general certification in infection control, or the CIC, and I also have the long-term care certification in infection control as well. Thank you very much, and we'll get started with the content next. One of the reasons I wanted to create this podcast was to create an environment where we could, learn from one another, share the information, infection control, where I could share my 24 years of experience in healthcare leadership, with most of that being, good portion of that being in infection control. So it's one of the reasons I was interested in creating this podcast, and, this opportunity to have guests on the podcast, and they can share their insights and their experiences with infection control. Infection control, it just involves so much. And we'll get into that with this podcast. The first episode is focus on vaccines as an example, but there's so much involved with it. The environmental side often gets missed, but it plays a vital role in infection control. So this includes disinfecting all your eye touch areas, and then, especially you want to increase that during outbreaks. And the more you do that, the more likely you're going to reduce any transmission of any pathogens or infectious diseases. So that's one part of it. Another part being that, the vaccines, which we're going to get into, talk about a key role in managing and controlling infectious diseases, especially during the outbreaks as well. So there's so much involved with it. The hand hygiene is one that probably doesn't get enough attention as it should. It plays a vital role in breaking the chain of infection with the hand hygiene. And then the PPE, the personal protective equipment, and the donning and doffing is so vital as well in terms of infection control. And we'll get into it later when the episodes of the podcast talking about the importance of auditing. So you want to be doing in your home or hospital, you want to be doing regular audits to see. It provides a gauge of where you are with the IPAC measures being implemented. So when you do the audits, you're going to see trends, and the more audits that you complete, the clearer those trends will become, where the gaps are, and where you need to focus your education with the staff by doing these audits. So this podcast is going to get in, be obviously being an infection control exchange is focused on infection control, but it involves so much. And we're going to get into all those areas, talk about those areas in this podcast. In this section of the podcast, we're going to talk about the COVID-19 and influenza vaccines. These vaccines have been around for a while. COVID-19 for a few years. The influenza vaccine goes back even further for about close to 20 years. But they play a very vital role in terms of infection control and outbreak management. So I want to talk about both of these vaccines and the importance of getting these vaccines. We're currently at the start of the respiratory season in Canada. And, these vaccines help a great deal in terms of outbreak management as well as I mentioned, infection control. So every year, these vaccines currently varies, but for long-term care, for example, it's currently receiving this vaccine a couple times a year. The influenza vaccine once a year, and the reason is because the virus associated that you're trying to protect, they're changing. So a lot of people are familiar with the influenza vaccine, and the reasons why you need to get that vaccine every year. It's because the virus is mutating and changing, and if you don't get the vaccine every year, you don't have that protection. So it's no different for the COVID-19 vaccine. That virus, those viruses are changing all the time, mutating, and if you don't get the most current version of the vaccine, then you're not going to be protected or fully protected enough. So that's why it's so important to get these vaccines annually. Currently, in healthcare, it varies a lot in terms of influenza vaccine. You see some organizations with very low uptake for the vaccine. It could be like 40, 45, 50%. And then you'll see some organizations doing extremely well in their uptake of the vaccine for staff and say residents or patients, where it's could be like 90% or a little bit higher, 90%. And that's what you're kind of going for. You want to get to that I percentage because then provides more protection for everyone and limits the spread of those viruses. So unfortunately, COVID-19, there's still some vaccine fatigue from the pandemic, unfortunately. But you really do need to think about influenza and COVID-19 kind of in similar lines that if you don't receive that vaccine, those vaccines, then you're not going to be protected from the most current variants of those viruses. So that's why it's so important to get the vaccine every year. I'm aware, some people get the influenza vaccine every year, but they don't get the COVID-19 vaccine. So it's interesting because you're protecting yourself against influenza, but you're not going to be protected against the COVID-19 vaccine. So for listeners, you always want to think about that and consider getting both of those vaccines because they play such a vital role. One of the things I wanted to kind of go through and speak about is those vaccines provide or play a vital role in infection control and outbreak management. So, whether, someone is a patient or a resident, for example, for long-term care or in an hospital, so important for staff to get the vaccine because you're bringing those viruses into the hospital or into the long-term care home, and you want to make sure that you're providing protection not only for yourself and for your family as well, but also for the residents and the patients as well, because you're probably more likely going to be the staff member that's going to bring these viruses into an acute care hospital or a long-term care home. So the more you do in getting these vaccines, you're protecting these vulnerable patients or residents in these facilities. Um, and the same thing for family members. If they get the vaccine as well, it's reducing the chances of bringing those viruses into those hospitals or long-term care homes, for example. So it plays a vital role. The more people are protected, or more people that get the vaccine, the less likelihood of that resulting in an outbreak in a long-term care home or an hospital. So this is why it plays such a vital role. And you want to get those vaccines, early as well, because it takes, a couple weeks before you get full protection from it. So this is right now we're entering the respiratory season, and it's going to could be a very busy respiratory season, and these viruses are going to be circulating, and you want to avoid coming down with these viruses and infectious diseases. So you want to get these vaccines pretty soon, and protect yourself, and as well as your family, as well as and if you're visiting hospitals or long-term care homes. So, um, but it's play a role. I've been part of infection control and vaccines, immunizations for probably about 15 years or longer. So I've managed influenza campaigns for public health, as well as doing that through like long-term care and primary care as well. So considerable experience working with the vaccines, and ensuring that the supply of vaccines is maintained with the cold chain, so it maintains its effectiveness. But I do have a fair considerable experience with the vaccines, and they play a vital role for everyone in terms of infection control. So in terms of prevention, if we can get as many people vaccinated, that includes the visitors and the staff, then much less likely you're going to have an outbreak. So we want to get those immunization rates very high. Like I said earlier, ideally in the 90%. And, I think the thing is I try to remind everyone is, you just don't want to be thinking about yourself when you as in getting these vaccines, right? It's yes, protect yourself, but you want to also protect those that you're going to be exposed to. And if you're visiting a loved one in a hospital or a long-term care home, and you don't receive the vaccines, then you could be bringing these viruses into an hospital, and people are in a hospital with they're very vulnerable patients, as well as in long-term care. You got a very vulnerable residents due to their age, as well as comorbidities. So they have a number of conditions, and that increases their risk of having, a serious outcome to getting coming down with one of these viruses. So it's always important to think about these vaccines and what they can do to protect not just yourself and your family members, but other people, right? So we sometimes forget about the fact that these vaccines can provide that protection for anyone who's vulnerable in these types of facilities. So it's extremely important for you to think about that, and not just your own personal health of importance of getting these vaccines. But um, one thing when I've done infection control and done training in infection control for staff and everything, I try to remind the staff that they've chosen to work in these facilities. So you've chosen to be a healthcare worker in a long-term care home, or you've chosen to be a staff member in an acute care hospital, for example. So you've made that choice to work with a vulnerable population. So you do need to think about those patients and those residents and what you can do to protect them. And that includes, doing your hand hygiene and wearing your PPE, but also reducing the chance that these viruses get into a home or a acute care hospital. So if you get these vaccines, you're providing that protection. And I also explain to staff that, if they, if someone's, let's say, in their 40s get the vaccine, the chances are, um, or if they don't get these vaccines, that it could be okay. I mean, the COVID-19 vaccine's been out for a number of years. Everybody's received, most people receive a number of the dosage and stuff. So um, they may be fine, but not there's no guarantees, right? The risk is not zero for anybody, no matter the age. So it's important to get it. But if someone is, 85 with a number of comorbidities or illnesses, their risk of having a serious outcome, including death from that COVID-19 virus or the influenza virus, is considerably higher than someone who's in their 40s and healthy, right? So you have to think about that type of outcome and why it's important to get these vaccines. And it's the time now. It's become so, globally, it's become so easy to receive these vaccines. You can receive them, I think, in most places, at the same time. So it makes it easier I think a lot of places it's fairly easy to receive the vaccines. So I think it's, so important for us to, they've made it very easy, including the pharmacies giving the vaccine. So I think it's important that we take the opportunity. This is a great opportunity. Now we're in mid-October to get these vaccines and provide protection for yourselves, as well as your family members, and as well as anybody that you might come contact in the community, for example, as well as acute care, like for example, hospitals, as well as long-term care homes as well. So please think about that and get those vaccines in the next few weeks or as soon as you can. And we'll move on to the next section of our podcast. Thank you. To add to the discussion on the vaccines like COVID and influenza, there's a lot of misinformation out there or myths regarding these vaccines. And I think that'd probably be a good topic for a future episode of the podcast. But I just want to kind of touch on it a little bit here and talk about it today. So one of the things for both of these vaccines, so the COVID-19 vaccine and the influenza vaccine, so one of them, sometimes you'll hear people saying that that the vaccine made them sick. That's actually not possible because in creating these vaccines, they use components of the virus, and it's dead, so it's not alive components of the virus. So there's no way that it's going to make you sick. But what can happen is someone can be already infected with influenza or COVID-19, so they've already been infected somehow, exposed, and then they get the vaccine, shortly after that, and those viruses got an incubation period where there's no symptoms, and then they get the vaccine and they think that the vaccine is what made them sick, but they were already infected. And that is why sometimes they draw that link between, the vaccine made me sick, which is not the case. So I think, we'll focus a future episode on that, focus on those myths. But one of the things I want to add to about the vaccines is that, they're not 100% effective. So, and sometimes some years I'll pick up for the influenza vaccine. Sometimes years it matches what's circulating better than other years, and those years where the vaccine that's been created matches what's circulating, you have less influenza cases occurring because the vaccine is providing the protection. The same for COVID-19. It takes some time. It takes a couple weeks actually before you're fully protected from these vaccines. So that's important to know that it takes. You're not going to receive these vaccines and then be fully protected the next day. It's going to take up to a couple weeks to be fully protected from these viruses with this vaccine. So it's important to take that in consideration. That it takes some time. I mentioned that it's not 100% effective, but um, even when there's a mismatch of the vaccine with the strains that are circulating for COVID-19 or COVID or influenza, it's still going to provide uh, the person with some protection. So even when there's a mismatch, you still get some benefits from getting the vaccine. So that's why you should always get the vaccine, is because even if there's if this dominating or circulating strains is not what's included in the vaccine, usually you will still get some protection. So that's why you want to be getting those vaccines annually to get that protection. But it's mentioned that we'll talk about those myths in more detail, because I do think over the years when I start working for public health, some of those myths were out there, and I certainly was providing answers to those to counter those myths, provide accurate information. But I think with social media, it's much easier for that misinformation to get out there, and harder to respond to all that. So I think over the last 15, 20 years, it's only grown, that misinformation. And so that's why important, I think, for podcasts like this one, which is focusing on infection control, to do its part into answering some of those myths. But for this first episode, I just got into it a little bit in terms of those myths, and in future episodes, I'll probably dedicate one to just myths for the COVID-19 and the influenza vaccine. I wanted to talk about a few uh, key takeaways from this first episode of the podcast. So, we talked about the vaccines a fair bit, but one of the things is that take-home messages for this vaccines is that we all have a role to play, and I did refer to like long-term care and hospitals in this episode. But the vaccines, like I said, mentioned, like it's when you get these vaccines, it's just not for yourself, which is important to protect yourself from these infectious diseases. But you're also protecting, family members, people in the community, and any loved ones that you're visiting, or when you're going into hospital. Uh, you have exposures through the environment or through direct contact with patients, and in long-term care with residents. So, we're trying to protect everyone. And these vaccines go a long way in terms of infection control for these infectious diseases. So the more people that get the vaccine, I'll use long-term care as an example, then the less likely you're going to have an outbreak in that long-term care home with a higher vaccination. So from staff, so the higher you get your vaccination rates for staff and family members that are coming in or visitors. So the more they're vaccinated, the less likely that virus is going to be spreading into the home. To wrap up as well is, within hospitals, within acute care, and within long-term care is also, it's not just for visitors and like the family members and the staff. It's also important for the vaccine programs like influenza and COVID, as two examples, to ensure that the patients and residents are getting vaccinated as well, right? So the more residents that are getting vaccinated or patients, then the less likely you're going to have any issues or any outbreaks in those areas or those homes within a hospital. So it really is a team effort, and the more that we work together, get as many people vaccinated, make it easy as possible to get vaccinated, then we'll get those immunization rates as high as possible. Thank you for joining me on the first episode of the Infection Control Exchange. I'm Wayne Tucker, your host for this podcast. And each week, we'll get a chance to bring practical, real-world infection control conversations to the front lines of healthcare. The next episode, I mentioned that we'll talk about outbreaks and outbreak management, and get into more details on what we can do in those situations to prevent outbreaks from occurring. And once they do occur, everything we can do to manage the outbreak and get it declared over as quick as possible. If you found this episode helpful, please follow, share it with a colleague, and let's build this infection control conversation together. Thank you.